Welcome to the first module, Medical Terminology, from Chapter 2 of Unit 1. This course has been designed to be a review course to help prepare you to take the CRC, the Certified Risk Coder Certification Exam from the AAPC. This course has been divided into several modules that will help you better understand how medical terms are created, how they can be broken down into their different components, and how you can derive their meaning from those components, which is extremely important for you to know well in order to be able to understand the medical records you will be coding or auditing. Hello everyone, I am your medical coding instructor Michael Brown. Today's class is about basic medical terminologies. Now, I know some of you might be wondering why you need to understand these medical terms. As a biller, coder, or auditor, you need to have a strong understanding of the different medical terms that will be used by all of the other medical professionals whose documentation you will be dealing with for the coding and billing process. One slip-up with an improper code can cause a lot of problems for the patient. You wouldn't want to code lipoma, which is a fatty tumor, for lymphoma, which is a type of cancer. That's just one small example of why it is so important to know about medical terminology. In this chapter, I will show you how medical terms are created, how you can separate them into their basic components, demonstrate a working knowledge of root words, suffixes, and prefixes, and discuss the conventions for changing from singular form to plural form. Let's get started. The first step in understanding medical terminology is to be able to break down the medical terms into smaller, more distinguishable components. This is one of the more effective methods that is used when trying to understand and translate them. The components that we are going to utilize include the prefix, which comes at the beginning of a word. For example, in the word microbiology, the prefix would be micro. The suffix, which comes at the end of a word. Here, the suffix would be oology. The root word, which is the body of the word. In this case, bio. The combining form, which is the body of the word with a vowel added, usually an O. Microbiology is not the best example of this because bio already ends with an O and oology begins with a vowel. So this is the exception to this component. A good example of this would be cardiogram. The combining form of this would be cardio.
But where do these roots come from?
That's a very good question. You see, structures usually have a Latin descent, while procedures, diseases, and processes tend to come from Greek words. Now, let's dive into these root words first. Most of the root words in the English language and the medical field are derived from Latin and Greek, as I said earlier. Let's see some examples. Blepharo is the root word for eyelid. Hence, an inflammation of the eyelid that affects the eyelashes is called blepharitis. Bucco is the root word for cheek. That's why the cheek side of the molars is called mesio-buccal cusp. Cholecyst is the root word for gallbladder. Hence, the surgical removal of the gallbladder is called cholecystectomy. Do you see how these medical terms are derived from their Latin counterparts?
Yes.
Great. Let's look at some other words. Colp is the root word for vagina. Therefore, the surgical excision of vagina is often called colpectomy. Cyst is the root word for a fluid sac or a pouch and urinary bladder. That's why when we measure the health of the bladder, we call it cystoscopy. Derm is the root word for skin.
Oh, so that's the reason a physician specializing in skin diseases is known as a dermatologist.
Yes, that's correct. Encephal is the root word for brain. Can anyone name a disease containing this root word?
Encephalitis.
Yes, the inflammation of the brain is called encephalitis. Now you will remember it better. There are some more common root words that you should know. Entero is the root word for intestine. It is here for the same reason that the virus which transmits through the intestine is called enterovirus. Hemo, or hemo, is the root word for blood. Hence, the diseases and disorders related to the blood begin with hem or heme, such as hemorrhage. Can anyone name another disease starting with hem?
Hemophilia?
That's perfect. For those of you who don't know, hemophilia is a rare blood disorder and is also called the royal disease. Myo is the root word for muscle. Hence, the study of the structure and arrangement of muscles is called myology. Myelo is the root word for the spinal cord and the bone marrow. That's why the nervous system disorder, which affects the spinal cord, is called myelopathy. Onycho is the root word for nail. It is for this reason that nail fungus is called onychomycosis. Osteo is the root word for bone. Hence, when the bones become weak and brittle, the condition is termed osteoporosis. Phlebo is the root word for vein. That's why when we incise the vein with a needle, it is called phlebotomy. Pulmo, or pulmomo, is the root word for lungs. Hence, the artery which carries the blood from right ventricle of the heart to the lungs is called pulmonary artery. And lastly, synovial is the root word for synovial fluid, joint, or a membrane. That's why the inflammation of synovial membrane is called synovitis. Let's check out some words and see if you can tell their root words. For the next part, let's take a look at some examples where prefixes are used. Remember, prefix comes at the beginning of a word. Ab is the prefix for away. Some of its common daily use examples are abduct, absent, and absolve. Ad is the prefix for toward or near. For example, adjacent, adjust, or advocate. Ante is the prefix for before. A good example of this is the term antediluvian, and more common example would be anterior. Ec or ecto is the prefix for out or outside. That's why for some words related to omitting or excluding something, we use this prefix. Exit, exclude are some common examples. End, endo, is the prefix for in or within. Entrust, enslave, are some of the words which are associated with it. Mono is the prefix for one. Can you guys tell me an example for this prefix? Come on, it's an easy one.
Monopoly?
Correct, very good. Similarly, poly is the prefix for many or much. Examples being polygamy or polymer. And post is a common prefix which means after or behind. You may have heard the term post-op, which is in relation to this. Postgraduate, post-mortem, or postpone are some other common examples. Now let's check your understanding of these prefixes. Now that we have a fair share of idea about prefixes, let's look at some suffixes. Synthesis is a suffix for puncture or tap.
You told us that all these suffixes and prefixes come from Latin or Greek. What about this term?
Good question. It comes from the ancient Greek kentesis, which means an act of pricking. So, when we talk about any act which involves puncturing or penetrating, we use this suffix. An example of this is pericardiocentesis, which is the removal of excess fluid from around a patient's heart. Let us dissect this term, pericardiocentesisto. It can be divided into three parts: para, cardio, and centesis. Para means around, as in perimeter. Cardio means heart. And centesis, as I already said, means to puncture.
Now I see. Breaking down big words helps us remember the meaning of it without looking it up.
Precisely. Let's take a look at some other suffixes. Desis is a suffix for binding or fusion. An example of this is tenotosis, which means a suture or the joining of the end of a tendon to a bone. Ectomy is a suffix for excision or surgical removal. It is derived from Greek ekta, which means the act of cutting out. In fact, most of the surgical procedures have this suffix in the end. Appendectomy, the surgical removal of appendix. Nephrectomy, the surgical removal of kidneys, just to name a few. Graphy is a suffix for the act of recording data. A common example in medical terminology is mammography, which is the technique of using X-rays to diagnose and locate tumors in breasts. Mammo is the root word for breast, while graphy, as we know now, is the suffix for the act of recording data. Pexy is the suffix for surgical fixation. Colopexy, which is the surgical procedure of attaching a portion of the colon to the abdominal wall, is an example of one such suffix. Plasty is the suffix for plastic surgery, plastic repair, and reconstruction. Rhinoplasty, which is the medical term for a nose job or the plastic surgery for the reconstruction of the nose, is an example of this suffix. Tripsy is the suffix for crushing. Lithotripsy is a great example of this, which is the procedure of using high-energy shock waves to fragment and disintegrate kidney stones. In this, litho means stone, the root word for stone, rock, etc., and tripsy means to crush. Let's play a game and see how well you familiarized yourself with these suffixes. There are certain guidelines that we need to keep in mind when changing from singular to plural form. Words ending with the letter A have a plural ending of AE. Think of the word vertebra, which ends with an A. The plural for that would be vertebrae. Words ending with EN have a plural ending of INA. For example, lumen. So the plural example of lumen will be
Lumina.
correct. Words ending with EX, IX, YX have a plural ending of ICES. For example, index will become indices. Words ending with IS have a plural ending of ES. The word prognosis will become prognoses. Words ending with MA have a plural ending of MATA. A very common example is the common biological term stigma, which you might have heard. Its plural form would be
Stigmata.
correct. Now the words which end in NX, ANX, INX, or YNX have a plural ending of NGES. The plural term of the term phalanx is phalanges. Words ending with ON will have the plural ending A. Think of the word phenomenon. Its plural would be
Phenomena.
words ending with UM also have the plural ending of A. For example, serum will become sera. As last example, let's see the words ending with US. Their plural ending would be I. For example, thrombus would be thrombi. We have touched the important points related to root words, prefixes, suffixes, and plural endings in this chapter. Lastly, let's go through some important points once again. Firstly, the root word is the main meaning of the word, the meat as we call it. Secondly, the prefix and suffix are there to help you to clarify what the meaning of the root word is. So let's translate a word. First, start at the end of the word. Then you go to the beginning of the word, and the last part you translate is the middle of the word. A really great example is to illustrate the word microscopic. How shall we approach it?
First, we take the last part.
Yes, first we take the last part, IC, which means pertaining to. Then we take the first part, micro, which means small. Lastly, we'll take the middle part, scop, which is...
An instrument for looking.
Yes, that's right. So that's how we break the words. Let us take another example. The word orthodontist. Again, we take the approach of taking the last part, the first part, and then the middle part. It is broken down as ist, specialist, in orth, straightening, dont, teeth. We have reached the end of the first module of our second chapter. I have given you a basic overview of the concept of root words, prefixes, suffixes, plural endings, and how medical terms can be broken down into smaller components to help you grasp a better understanding